This study is a very broad sort of kind of analysis, but it at least gives us a sense that not every group is the same.
Dr. Eugene Yang is a cardiologist and a professor at UW Medicine's Division of Cardiology.
My research focuses on understanding the differences in cardiovascular risk between different Asian subgroups.
While the American Heart Association names distinct factors that impact heart health, things like diet, weight, exercise, and cholesterol, Dr. Yang's research points to other reasons that put people at risk for cardiovascular disease, things like education level, income, and housing security. He calls them social determinants of health.
When you combine these different social determinants of health, what we were interested in finding out was how does it affect different Asian populations.
It's the crux of Yang's research published in the Journal of the American Heart Association. Yang says Asian Americans as a whole have low prevalence of cardiovascular disease. But when you zero in on each demographic, subgroups within the AANHPI community have varying risks of heart disease, especially when you consider unfavorable social factors like housing insecurity, unemployment, and lower income. For example, the research found those unfavorable factors led to a 45% greater chance of type 2 diabetes among Chinese adults, but a 24% greater chance among Filipino adults.
Historically, Asians have been lumped together, and so it doesn't really help us discriminate the differences in cardiovascular risk between certain Asian populations.
Dr. Yang pointed to other research being done right now to dive deeper. Fred Hutch recently received a $38 million grant to explore this very topic. The goal, closing the gaps in knowledge within the unique health issues among AANHPI subgroups.
Asians in general are felt to be this model minority, that we are more educated, that we have more higher levels of income, access to healthcare. And so when you combine all of us, that might be true. But then when you start to do studies like this and you start to disaggregate the Asian populations, you see that there are very significant differences, which is very important.
Fred Hutch is coordinating this research alongside the National Heart, Lung, and Blood Institute, and it will span 7 years. For HealthLink, I'm Christine Pei.